Whenever practitioners are working with patients, their goal is to help the patient overcome whatever health challenges they may be dealing with. Testing can be really helpful to uncover information and give more targeted interventions for the patient. But it's important not to get drawn into the protocol for the condition, rather than focusing on the person before you and all the information you have already. One of the best ways is to think more analytically about the testing process and to break it down into steps. Step 1 is asking yourself, what is the most important thing I need to know now? What's the most important question that I need to ask here? This could be based on a number of things, including the patient's history, their symptoms, and other cues to help create a holistic picture of what's really happening with them. The trap in our industry is thinking, okay, so this person has scleroderma, I'm going to pull out my scleroderma protocol and start with a stool test or an Epstein-Barr test. But instead, you have to speak to the person and see what comes out of their timeline and what their goals are. And then think about the information that you already have. What's the most important piece of information that you need to be able to progress? Not to get to the end goal immediately, but to shift the needle a little first. Step 2 is confidence. To make those connections from their history and as much information as you gather to choose the best possible test. Step 3 is, am I going to be able to use this information from the test result now? Let me share some examples to explain this. Say you've got a perimenopausal woman who hasn't had a cycle for 50 days or 5 months. Are you going to map her cycle over a whole month? Is that going to change your intervention? Or are you going to do a one-day hormone test such as the Dutch Complete, which might give you more specific information but it's only on one day? Or are you going to give her stress support to help her resiliency and her adrenals to start with? The answer would be different depending on her timeline. Another example would be a highly stressed and fatigued person with IBS and a big toxic burden in their history. You may choose to test them for heavy metals like mercury and lead, but if they come back elevated, you're not going to be able to do anything about that because you need to sort the gut and the stress before you can help detoxify them. Metals testing is not the wrong choice, but you need to think what would be most impactful at that time. At the end of the day, it's not about the protocol for IBS or scleroderma or whatever else. It's more about treating the person, which is what functional medicine should be, instead of getting hung up on protocols. One of the ways you can overcome this is to not get stuck in a rut of only using one company or just doing the tests that you're comfortable with, either due to familiarity to you or possibly to the price point to the client. It's okay to use one test 75% of the time, as long as you know that in some circumstances you'll get better value for that person from a different company's lab tests. Don't marry yourself to one brand. This is why in the Applied Functional Medicine Mentorship Program, we mentor practitioners to become comfortable looking at different testing systems. We focus on helping practitioners to get comfortable outside of their comfort zone. To go deeper on this and related topics, register for our free masterclass, How to Boost Your Clinical Confidence Practicing Functional Medicine. Simply scroll down to the bottom of this page.